project's about providing opportunities for homeless young people to get into employment while being provided with accommodation by the hospital's trust. So working on apprenticeship schemes within the hospital, accommodated within hospital accommodation, but supported by St Basil's whilst in that accommodation, which enables them to participate in the programmes without claiming any benefits, which I think is the uniqueness of the project.
We're widening participation in terms of the apprentices who've got access to employment with us, or traineeships or apprenticeships. But also the people within our trust are working with the apprentices, and it's perhaps stopping the stigma of people for homelessness within, and they're accepting a widening of people in their environment within the workplace, and it's showing that we are doing it within the fabric of our organisation.
A few young people have already completed their apprenticeship. We've had one young lady that's gone on to a higher level apprenticeship. She wants to be a nurse, so for her that's just been absolutely amazing. Before she started the project, she was living in St Basil's supported accommodation, being on housing benefit and job seekers allowance, and now she's actually got a level 2 qualification. She's benefit free and she's working. So to us that is a huge achievement, and I do not think this young lady will ever go back on benefit.
I think it would be the cherry on the cake, and the fact that it recognised the partnership working, how collaboration can mean that how you come together and all change people's lives.
The community experts are a network of volunteers who've kind of given their time for our staff to be able to understand cultural and faith issues.
The seminars have had a great buzz around them. They've been very well organised, and they're just really friendly, welcoming spaces to talk about issues that it's very, very difficult sometimes. I didn't have as much understanding as I thought I had until I'd actually been to one of these seminars, and so it wasn't as though I was then feeling fully equipped to deal with these issues, but at least there was an awareness of knowing what I don't know and being able to kind of use the network for further advice as and when I needed it.
The mental health first aid training provided by the Trust increased my confidence. It's an honor to be contacted by professional staff and be able to help them understand Polish cultural and religious issues. I feel I'm making a real difference in other people's lives, and that makes me feel great.
We know that survey after survey, patients tell us that they feel that their recovery journey is enhanced when their spiritual and cultural needs are understood. So we're really pleased that we're making a real difference. In terms of what's been achieved, our staff have been accessing our volunteers, and they've been helped with potentially ambiguous or complex scenarios, so there's been a direct benefit in that sense. Also, our staff have been introduced directly to community organisations so they can signpost on. It would be amazing to win an Excellence in Equality Award. It's a real recognition, a real boost, especially for our volunteers who so kindly give their time, and I think it would be a real encouragement.
Birmingham and Solihull Mental Health Foundation Trust, really proud to be working in partnership with the Birmingham Repertory Theatre to put on the Bedlam Festival 2015. It was the second festival of its kind, and really trying to use the arts to get across messages about positive mental well-being and to try and reduce the stigma and discrimination against people with mental health issues.
Bedlam Festival enabled people in Sandwell and West Birmingham to access theatre and drama work and also professional training on the subject of mental health. Some of the events were free and they were all across 1 week, so it enabled people to go and see work that maybe had some resonance for them. We've had personal testimony come back to us, and individuals have told us their stories. One person said that they suffered from anxiety and they used the festival as a means of overcoming that anxiety to get them out and about and seeing work that meant something to them. We've commissioned a new piece of work called Jump Will Catch You, which is a new play by Charlene James, and that has been toured into mental health settings, so people who've been unable to see the work in theatre have been able to see it in their own settings.
It was fantastic to put on a really eclectic mix of drama and other art forms to really stimulate discussion, and really pleased that over 2,000 people accessed the festival in the month of October.
I think all three of us would be very excited about winning this award, not just for our own organisations, but for the message that it would give about the importance of the arts in well-being and mental health.